Welcome to Part 2, Section 2A. In this section, we will show you how to create an order set triggered by a diagnosis. This will help you to simplify creating a treatment plan for the management of your CKD patients. Okay, let's begin. Let's begin by creating an order set that can be triggered by a particular diagnosis. Click EMR on the top menu bar. Then click Order Set Administration. When the order set window opens, click New. Across the top of the window, new options appear to enter the new order set description and measure. We will enter diabetes, hypertension, and CKD for description. For now, we will leave the measures box blank. However, if you know the ID number for the CDSS quality measure, you can enter it here. Otherwise, we will demonstrate another way to associate the order set with a quality measure later in this section. Orders can then be selected by using Quick Order Sets without opening the order set window. Since there may be many options we would like to include in this order set and the list may be too cumbersome, we will check No for Quick Order Set. Then click OK to refresh the window. Next, we would like certain diagnoses or assessments to trigger our order set. Click Update to expand the window again. Now, two more options have appeared. Leave the box next to Same as Trigger for diagnoses linked empty. Since there are so many ICD codes, the list will be too long to view in the progress note screen when we assess our order set later on in this section. Click the Add button next to Diagnoses, Trigger, and a pop-up window will appear. Here, we can search for all diabetes, hypertension, and CKD-related codes and assessments to include as triggers for our order set. Anytime one of these codes is entered under the patient assessment, the order set icon will turn from gray to red in the treatment pop-up window. We will demonstrate this once we've completed creating the order set. Now, let's add the medications we would like to include in our customized order set. Click Browse and a pop-up window appears. Here, we can search for medications used in treatment of patients with diabetes, hypertension, and early chronic kidney disease. Type Humalog in the Find box. And a list of all the Humalog prescriptions appears below. Highlight the name, then click on the prescription to add to our order set list. We will continue to add more medications that may be relevant for these diagnoses, while you try it too. Next, we will add relevant labs, such as urine microalbumin creatinine ratio, hemoglobin A1C, and eGFR. For diagnostic imaging, we may need an echocardiogram, electrocardiogram, or renal ultrasound. Under procedures, we will select routine venipuncture. For immunizations, select influenza and pneumococcal. For smart forms, we may want to include initial visit and tobacco control. In order sets, you can even set up follow-up appointment intervals and then add outgoing referrals. Here, we will select nephrology, vascular surgery, finally, we can add physician and patient educational resources here as either a website or PDF. We recommend www.kidney.org. which has links to an eGFR calculator, clinical action plans, KDOQI and KDIGO guideline recommendations, and easy-to-understand patient education tools. We also recommend www.diabetes.org for clinical guidelines in diabetes care and useful patient education and support resources, and www.aakp.org as another source in patient education. If you would like to enter a summary of treatment guidelines for easy viewing, type that information in the messages box. The note will appear at the top of the window when the order set is assessed from the progress note. We will type, "Please be aware of the risk factors for chronic kidney disease, diabetes, hypertension, family history of CKD, diabetes, or hypertension, U.S. ethnic minority status, and age greater than 60 years old." CKD is defined as kidney damage for 3 months or longer, or GFR less than 60 for 3 months or longer. The order set saves as our orders are entered, so we can just close the window to complete our order set creation. Now try it. This concludes Part 2, Section 2A, Diagnosis Triggered Order Sets.